Nitrates are inorganic compounds found in many vegetables, such as spinach, celery, radishes and lettuce. But beetroot is one of the highest sources. Nitrate contributes to the production of nitric oxide, which has an important role to play in immune function, as well as regulating the tone of blood vessels, which impacts blood pressure. In this podcast, I look at the evidence for using nitrate-rich beetroot juice to treat high blood pressure, as well as its role as a supplement to improve athletic performance. Beetroot juice is getting a lot of attention, with claims that it can boost stamina to help you exercise longer, improve blood flow, and help lower blood pressure. There is a growing dossier of clinical evidence to help support these claims. And it's all thanks to natural chemicals called nitrates that are found in beetroots. Though green leafy vegetables such as spinach and lettuce, along with radishes and even parsley, are all good sources of nitrates too. Nitrate is converted in the mouth and stomach to a potent chemical called nitric oxide. Nitric oxide has many roles in the body, but its most important role relates to acting as a vasodilator, where it helps open up blood vessels, allowing more blood and oxygen to flow to the muscles. And a positive side effect of this vasodilation can be a fall in blood pressure. Nitrate may also reduce the energy cost of exercise and positively affect muscle contraction. Hence the dual interest in nitrates as a way to treat high blood pressure, as well as its use as a sports supplement to improve athletic performance. So first, let's tackle high blood pressure, also known as hypertension. High blood pressure can result from a gradual hardening of the arteries that can make them more resistant to dilation. This loss of elasticity over time increases resistance to the force exerted by the flowing blood, resulting in an increase in blood pressure. So, in adults with hypertension, are the nitrates from beetroot juice able to have a significant effect on reducing blood pressure? That was the topic of a recently published systematic review, and I'll link to this review in the show notes. The review included 7 randomized control trials that had over 200 adults with hypertension take between 70 and 250 ml of beetroot juice, or a placebo beetroot juice drink that had its nitrate content depleted. And the trials ran for between 3 and 60 days. Overall, there was a small benefit when taking the nitrate-rich beetroot juice, with a significant fall in systolic blood pressure, which is the higher of the two readings when blood pressure is reported, such as, for example, 120/80. And this fall was in the range of 5 millimeters of mercury. For the diastolic reading, which is the lower number, there wasn't much evidence for a drop. But it was interesting that the results varied depending on the setting where the blood pressure was measured. Blood pressure data collected in a clinical setting, such as a doctor's surgery, was more likely to show a fall compared to blood pressure readings taken in a more free-living ambulatory setting, using 24-hour monitoring equipment. Now, this could be related to a measurement artifact or an issue with doing subgroup analysis, meaning you have less data to analyze compared to pooling all the data together. But it does appear that nitrate-rich foods, such as beetroots, can have a small benefit on blood pressure, which could be important when added to other positive lifestyle changes, such as exercise, quitting smoking, drinking less alcohol, and of course, eating healthier. And no surprise that all the nitrate-rich foods are healthy for a whole bunch of other reasons too. Okay, so that's the clinical side of nitrates covered. What about for those who are looking to gain a performance edge in their sport? What does nitrate-rich beetroot juice have to offer you? If you don't follow the world of sports supplements research very closely, your reaction to knowing that athletes are chugging down shots of beetroot juice may be along the lines of what sorcery is this? But this is not some faddish trend like Rubik's Cubes, finger spinners, or activated almonds. There is now good science to show that beetroot juice, or more specifically those nitrates in it and the nitric oxide made from it, can have a significant benefit on sports performance. So again, nitric oxide is a potent vasodilator, meaning it improves blood flow and oxygen delivery to working muscles. Nitric oxide thus improves the muscle's efficiency in using oxygen. And nitric oxide also augments exercise performance by the enhanced function of type 2 muscle fibers, which are the fast twitch muscles used in powerful bursts of movement such as sprinting. And finally, nitrate, through nitric oxide, can result in a reduction in the energy cost of muscle contraction and increased efficiency of mitochondrial respiration. That's a lot of information, but taken all together, this means the muscles are finely tuned for explosive power when oxygen levels are limited. So the big question, will drinking beetroot juice improve athletic performance? And with several dozen exercise studies looking at beetroot juice and nitrates and sports performance now published, the results are looking very promising. In fact, nitrates were one of the few supplements to get the tick, but having good evidence behind it in the 2018 IOC Consensus Statement on Dietary Supplements for Use by High-Performance Athletes. And I'll link to this document in the show notes. So let's go over a summary of those benefits. Athletes who supplement with beetroot juice, which contains an adequate amount of nitrate, on average gain a small benefit on exercise endurance. The most commonly studied exercise situations have been cycling and running trials, from about 4 to 30 minutes in duration. At an elite level, clinical trials show a small but competitively meaningful benefit in time trial performance. And recreational athletes seem to gain an even greater benefit from beetroot juice, which could be because of less prior adaptation of the cardiovascular system to exercise. So taking on extra nitrate in the form of beetroot juice can improve the exercise economy of athletes when working at a constant load, while running or biking, which translates into a slightly longer time until exhaustion. So for endurance athletes, this could convert into a small competitive advantage. Supplementation is also seen to improve performance in high-intensity, intermittent team sport exercise of 12 to 40 minutes in duration. But beetroot juice appears to have little effect on power output, but seems to reduce the rate of fatigue seen with continued muscle contraction. That means beetroot juice has the most benefit in exercise ranging from 1 minute up to 10 minutes, or for muscular endurance events such as sports requiring anaerobic intervals such as football, hockey or rugby, and CrossFit type exercises. Typical doses of nitrate used in research studies have been in the ballpark of 400 milligrams. This dose of nitrate can be provided by a single serve of a commercial beetroot juice shot of about 70 mils, taken about 2 to 3 hours before exercise. Now, the highest dietary sources of nitrate are beetroots, celery, lettuce, and spinach. They contain about 250 milligrams of nitrate per 100 grams, but that level can vary, hence the popularity of the commercial beetroot shots, which gives you a fixed dose of nitrate. And even though beetroot juice can be made at home with a juicer, the concentrated shots are generally more popular owing to the much lower volume required than DIY juicers. For the same amount of nitrate as you would get in a commercial 70ml beetroot shot, you would have to chug down about half a litre of beetroot juice, which may not be too appetizing an hour before a race. And as a side note, athletes using beetroot juice should avoid using mouthwash or gum, as they reduce the bacteria available in the mouth that are essential for the conversion of nitrate to nitric oxide. So let's wrap all this up. There is little concern about harmful effects from taking beetroot juice, apart from some minor, occasional gastrointestinal upsets. But as anyone who has tried beetroot juice will tell you, be prepared for a colourful surprise on visits to the bathroom. What goes in purple comes out pink, but this pink coloration of the urine and stools is temporary and completely harmless. So that's it for today's show. You can find the show notes either in the app you're listening to this podcast on, if it supports it, or else head over to my webpage at thinkingnutrition.com.au and click on the podcast section to find this episode to read the show notes. If you find this podcast of value, then please consider sharing it with your friends and colleagues, or maybe even leave a review. This all helps increase the ranking and reach of the podcast, which means a big win for credible, evidence-based nutrition messages while helping to dilute out the crazy and making the world a slightly less confusing place. I'm Tim Crow, and you've been listening to Thinking Nutrition.